For as long as my siblings and I can remember, our dad has given unconditional love to our family and passionately advocated for the health needs of the Asian American community. He started off at Asian Health Services as a young college volunteer.
Asian Health Services, when I first worked here and was a board member, there was a close association about what's happening in the community and what was happening in the civil rights movement, what was happening in the student movement. And we felt that these were all tied together.
You will not be able to stay home, brother.
As a kid growing up, I know it wasn't that easy for my parents to be able to provide for me all the things they wanted to provide for me. And when I see people that Asian Health Services cares for, I see basically my family. I see basically my grandparents. I see my aunts and my uncles in a figurative sense. I think that as a doctor, it's really important to understand that it is a privilege to take care of people. They give me so much more than I give them. They give me their wisdom. They give me their insight. They give me a sense of what's really happening with their lives. So as a doctor, I would often talk to our patients about the importance of going to our meetings to get community input about how our programs would develop at Asian Health Services and how they need to speak before City Council and Alameda Board of Supervisors with regards to the need to keep funds and services going to the Asian immigrant community.
So it was fun working with Winston because, number one, he was an outstanding clinician. He's also the funniest person I have ever worked with. He's a lot of fun.
One thing that I really felt early on at Asian Health Services is that we were just too serious around here. And I don't mean to make light of the fact of the challenges of taking care of patients, but I also really want to say there's a joy in seeing patients, and there's no reason why we shouldn't have fun seeing patients.
With Winston, I have a favorite story. Our families used to go to Disneyland together, and when the kids were a little older and kind of knew what was up, we were on a ride together, and my daughter and Winston and I were on this ride, and something came up about Winston being a doctor, and I said, "Oh, Uncle Winston's a doctor," and my daughter said, "Nah," and I said, "No, really," and she looked at Winston and he was just laughing, and she kept saying, "Nah," and I said, "Well, how come not?" And she said, "Oh, because he's too goofy to be a doctor."
Well, all of us that work with Winston understand his commitments and his values, and we understand that his first commitment is to the San Francisco Giants. And then after that comes the community that he supports and is active in, and making sure that Kaiser Permanente is a part of that.
We think at Kaiser Permanente that by investing in our communities, supporting agencies like Asian Health Services, that it makes our organization and our membership, the communities that we work in, really a better place for everybody.
Winston's primary role for Kaiser is building our relationships with the safety net, with community clinics, with public hospitals, and with local health departments.
The work I do at Kaiser is very proactive in identifying ways that we can provide dollars, technical support, and probably most importantly, the kinds of relationships that are needed so that people can work together, groups can work together, organizations can work together to really build fabrics for healthier communities. I just really admire and am certainly honored to be associated with Kathy, Art, and Tessie. We all share a relationship to Sherry. Sherry's been our big sister, our agitator, our aggravator, and that's always something to share.
My brother, sister, and I have always admired our dad. We hope his advocacy for improving community health care will inspire others.
Oh, can't you see? I gotta be me.